I totally share what has been said by the past speakers. I think healthcare is really a matter of cooperation amongst different worlds. And I'm very happy to represent the mobile industry. I'm sorry, can I see my slides also on the screen? Or okay. So the next one. So mobile and health, what I will try to present to you is the way I envision the contribution of mobile operators towards a more personalized medicine. To start with, you will see that there are several mobile operators that are getting involved in healthcare. As Orange, we have an affiliate, which I'm representing, Orange Healthcare, which was started 10 years ago. So it's quite a long story for us, and we are only dedicated to healthcare. What you can see is that mobile is really, has always been something very personalized, and this was really a change in the telecommunication environment from telecom in general to personalized telecom. And I think mobile is going really to contribute to more personalized medicine. What you see is that today more than 7 billion people have a mobile cellular phone. So it's really close to 100% of people who have mobile phones. It's not always smartphones, but as Orange, we are very present in Africa. We are in 31 countries, 21 of them are in Africa, and we see that we can really achieve a lot in regards to healthcare, also on basic 2G networks. Of course, when we are able to provide more speed and more bandwidth, we can do a lot more in regards to healthcare, but there is already a strong impact just with the basic networks. What we see is that, so as I said, it's not only close to 100% population coverage worldwide, but also in terms of network coverage, because that's very critical. If you talk about healthcare, you need to make sure that people are accessible anywhere they are. So you see that there is a very close to also 100% coverage in terms of 2G networks. And if we talk about the new technologies like, well, the past technology like 3G, it's getting close to 85% coverage. And then we are moving into new networks, which will allow a lot more. What we see is, so what do we call mHealth? It's really the mix of using mobile phones into healthcare, and we see a lot of applications. Today, the main focus is really on remote monitoring. That's the key driver in terms of value. It's over 60% of the value of the market. It's a lot of things that we can put behind that. It goes from chronic disease, remote monitoring, that's really amongst remote monitoring, that's the key driver too. We see that some disease like diabetes, for example, are very, very much using technologies like mobile applications, for example. This is, I would say some pathologies are more advanced than others, and what makes the difference in my view is how much patients are used to monitor themselves. We see that with diabetes, there is especially if it's diabetes type 1, people are really used to monitor themselves from a very young age. And mobile is just the perfect tool to support that monitoring. So we see this is pretty advanced. We are other pathologies where it's just starting and there are new applications being developed. Post-acute surgery is really key too. We are contributing a lot. I think someone was mentioning ambulatory care, which is really key to develop. So when you go back home, that's really critical to have the right support, not just reminders to take your medicine or to do the right movements, but really as much support as you can, because in some cases you will feel pretty lonely. It's the same also if you talk about oral medication in cancer. You're at home, you are not at the hospital, and you have a lot of side effects. So really mobile applications can support you. I totally agree with what was said before. This is just tools. So what really counts is what people are able to cope with, what they are willing to do, and the tools are there to support them. The tools are not managing the care. They are here as partners and supporting tools. Then, in my view, the last key point, which is going to grow quite fast, is aging at home. Also, in that case, you need as many tools as possible to make the coordination between the person who is at home, the doctors, the family, and also all the supporting people, whoever they are. And this is very digital. So this is really managed by mobile support and also non-mobile, but IT and telecommunication in general. Remote consultation and diagnosis is also a key driver in mHealth. Today it's about 15% of the value share as we see it, and we see it growing. So remote consultation, depending on the countries, and it's the same for any technology. One of the points that makes it big or small is really regulation. So that's a key point. In many countries, remote consultation is allowed. I'm coming from France. It's not allowed for the time being. But there are some trials. It's quite different in some other countries, but we see it as a growing pattern, and we think that will be key in the future. Mobile diagnosis, anything you can do to bring like a pre-diagnosis in a mobile medical device, for example, is really strongly developing. I think this is really key, especially for patient empowerment. This is really changing the speed. This is something that was mentioned, the prevention and the patient empowerment. Of course, we see wellness and prevention growing very fast too, and this will also be a strong trend in the future. On all this, really one of the key issues is what are the business models? We see more and more players, including health insurances, that are taking a lead on that. We think that there will be also more and more out-of-pocket spending from patients, but today, in many cases, the model is still being undergoing. So what we think is that mobile is really contributing to a major evolution in regards to healthcare, not just bringing patient empowerment, which is really key, but also in the relationship between doctor and patients, and in the speed that is bringing and really personalizing healthcare. So we were looking at what do we mean by personalized medicine, and I think I see two major points. One is that if you really want to bring personalized medicine, you need to collect a lot of data, massive data collection on groups of people, and then detailed data on individuals. And what we see is that thanks to all the connectivity that we get from the medical devices, this is really a way to massively collect data. So in this way, we see the big contribution of mobile into personalized healthcare. And then the second thing is, okay, once you've collected the data, you're able to identify trends, to prevent, to really focus on what is right for each person. Then the second part is engage people. And that's probably as difficult as the first one, because clearly a lot of, especially if we talk about chronic disease patients, a lot of the issues that are faced, like non-adherence to treatment, for example, it's not just because people don't know what they should do, it's just because they are tired of it. And so we also think that in the second point, which is really bringing personalized support and the right information at the right time to people, we also think that mobile is a nice way to help in that. So talking about massive data collection, What we see today is that a huge amount of, so I'm not even talking about all the wellness applications, all the devices that are for wellness, but also on medical devices. What we see is that they are getting more and more connected, not necessarily mobile. What we see today is that 30% of the medical devices that are connected, they are on fixed line. 30% are on mobile line and 70% are on fixed line. But what we see is that by 2017, this is going to change. So 75% of the medical devices that are connected will be on mobile connectivity. And then the other point that is key is that we see all those medical devices that are getting more and more connected. So if I just take two examples, talking about cardiovascular medical devices, today it's about 30% that are being connected. And by 2020, we expect it to grow by 35–40%. If I take respiratory masks, for example, today it's 12% that are connected, and we expect it by 2020 to be 50%. So those numbers, they really depend on things like regulation, reimbursement. Is there an incentive to have them connected? So that has a strong impact, but we know that the trend is for them to become more and more connected. And this is very interesting because today device manufacturers, they're all looking at those huge data that they are starting collecting and thinking, well, what should we do with it? Is it a new business for us? Should we sell them to someone? Is it a way to improve our services, to launch new services that will be better suited for the patient? So as a technological partner, we see all that thinking, and we think it's very interesting. Personally, I would say I always push our partners to reconcentrate on what is their mission, and how can they use this data to improve the way they support people. But I think it's very interesting, and there is a huge scope that is behind us on that. Another point is that from mobile, we are coming from a consumer industry, and I think it's very interesting that movement from people from the consumer industry with healthcare, which was traditionally very business-to-business oriented. And so we are bringing in the discussions a lot of things on how do you make a device that is tailored to the people and that is nice, that is fun, that you like to have, and not just that is very efficient for what is made for. We are also bringing all the work that we've done on big data, for example. So in our case, I was really using data to decide where you want to develop the network. But if you think that's also interesting to use those skills to say, where should we allocate the resources? And not just in Africa or in places where it's really far away to reach a doctor or hospital, but also in European countries, for example. It's very interesting to use those skills to decide how where you want to put the skills, and even within one hospital, how you allocate the resources. For years, we've been working on customer relationship management. And it's very interesting to see all the healthcare players really moving into whether it's hospital or whether it's big pharma or medtech or whoever the players are, really looking at how can they get a closer relationship with the end user, even though it's difficult for big pharma. But we think it's a very interesting move, and this certainly should be in the interest of the patient. A last point that I'm going to share with you on one of our contributions is we've also been thinking, can our own data be used for healthcare? So the data we have as a mobile operator, it's really like geolocalization, knowing where people are, who they are calling, what are the calling patterns. we are very strict on data usage. That's one of the specificity, not just from Orange, but from most mobile operators. We are very strict on saying our job is to transport the data, but we certainly will never look at what's inside the data, and we will not resell it. We will only use it to improve the services we are providing. So we've anonymized our data, and we tried to see if there was anything interesting to do with it in the healthcare business. And the first results of what we did, so we did a challenge which was giving access to that anonymized data. And we had a lot of public laboratories who worked on them and managed to develop some algorithm to, initially they thought to predict disease spread and to predict how one disease was going to move from one place to the other, which was very interesting. Just with our data, the result was just a little bit disappointing because it was hard to predict. We were explaining a lot of things, but always coming a bit late. This was used during the Ebola crisis, for example. This was a nice start, but we realized we needed to go much further. So today, for example, we are crossing additional data to ours. And in Senegal, for example, we are working with the health ministry. And what is interesting is that when you start crossing mobile data, anonymized, with health data from health ministries and medication sales data, then you are starting to get very interesting things. And we are pretty confident that we will be able to develop predictive models. Which will then allow people on site to allocate the resources at the right place, the doctors, the medication, and then which will be very powerful to prevent such epidemics. One thing I wanted to share with you is that, and I think that's very interesting, we are doing that in an open source model. This means that whatever we do, we make it accessible to all. We are a business organization, so it's key that we are looking at what is coming out of that to try to also develop some commercial products on our side. But we've decided to do that on an open source model, meaning that others have access to it, and others are also enriching the way we are developing the algorithm. So another point is, so my first point was how can we contribute to collecting data, which is so key for personalized medicine. And my second point was how can we contribute to bring that information to the right people at the right time. So for me, there are two key areas. One is mobile applications. So what we see is that by 2017, something like that, globally, all the research agencies agree to say that there should be something like 12 billion people that will download an application that is related to healthcare or prevention. So that's really massive. What we see is that everybody agrees that from all the mobile applications, more than 50% of the value will come from healthcare and wellness. So we see that this is very powerful, and there is a lot to do around that. We see a lot of companies working on patient support programs. Again, since we are kind of in the middle, what is interesting to see is that every player is working on the same thing. So we anticipate that there will be consolidation. Let's take oncology, for example. We see that hospitals are working on developing applications to support their patients when they are home. Same for big pharma, same for health insurances. So that's interesting. We see we are just at the beginning, and patients themselves are also developing some applications. So that's just the beginning. We know that one patient will not download 10 applications. So we anticipate that there will be that players will come together to build things. But that's probably the next phase, and that's not easy to achieve. Remote consultation and diagnosis, we see a lot of things that are happening. A lot of people that are developing, whether it's for electrocardiogram, for example, being able to read them by artificial intelligence. there are a lot of projects going on, a lot that are not so serious, but a lot that are great too. And we see that in the future, there will be a huge development of at least supporting diagnosis and helping in early diagnosis, which is really key. My last slide is a few examples that I decided to concentrate on Africa. So a few initiatives that we've managed. The first one is called Mobile Ramadan. We started this 3 years ago in Egypt. The idea is just to send SMS to all our customers and say, if you have diabetes or know someone, if you're interested during Ramadan to get support on how to eat, on some good habits, just send us your SMS number. It was incredibly popular. We had a Facebook page. It was liked by 3 million people in just 2 weeks. This is very simple. It doesn't cost much, but it's extremely effective. And then in terms of results, all the doctors we partner with just said it was not only great during Ramadan, but it was also great for a few months after that, so that people were keeping better habits. This is now being run in Senegal. It's not just by Orange. In Senegal, it's really by all the mobile operators and the health ministries. Simple, but strong impact and immediate impact. mHealth Line, it's a service we launched in Cameroon. It's SMS-based. You just ask for medical advice. It's not a mobile consultation. The health ministries was not so much in favor of that, but it's just medical advice. And that's also very useful. It's very cheap. It's just SMS-based because few people have access to smartphones, but that's also a great start into new healthcare. Microinsurance, this is also something we are partnering with a few players. So the idea is just to use mobile payments to distribute micro health insurance. A bit more complicated than we expected. There is a lot of fraud in health insurance. So it's difficult for the health insurance companies to have the right model, but at least they can distribute it in a very cheap way with mobile payments. Mobile data collect, it's a technology we have developed, well, it's a platform we have developed with EpiConcept, who is a small company working on epidemiology in Africa. And we are also partnering with some big pharma companies. And the idea is just to use that platform to gather a lot of data on vaccination, on health status of people, on mortality for kids. So that's a very simple way. Everybody has a mobile, so that's a very simple way to gather data and then to make sure that you give access to information to people. UniHealth, it's also a cooperation with, this one is very new, we've just launched, and the idea was to support them to improve the quality of the data they are gathering, because there was a lot of junk data they were collecting manually on paper, a lot was lost, and so we are working with them to use the mobile to improve the quality of the data which is being collected. Thank you.